Hi everyone, I'm Kisha Tyrrell, your host of Beauty and the Wise, the ultimate lifestyle and wellness podcast where we are redefining the narrative around what aging well looks like for the woman over 40. We are going to discuss topics ranging from hormonal health to fitness, nutrition, sexual wellness, personal development. Nothing is off limits. We will have industry insiders, experts, friends. We're going to cover it all. We want to be able to provide you with the tools that you need so that you can advocate for your own health and well-being. In today's show, we have a registered physiotherapist that specializes in pelvic floor health. We're going to dive deep into understanding all the things about the pelvic floor and how it has an impact on your overall health and well-being. We're going to talk about the impact when it comes to perimenopause and menopause and any changes in the pelvic floor. We're going to discuss symptoms, treatments. Michelle Monk of Optimum Wellness, registered physiotherapist, is here to give us the scoop on everything we need to know pelvic floor. Michelle, welcome to Beauty and the Wise.
Thank you so much, Kisha. Thank you for that introduction. I'm honored to be here and talk all things pelvic floor with you.
Great. So before we start, tell us about Michelle. Who is Michelle Monk?
Thank you. So as you said, I'm a registered physiotherapist. I've been practicing for what feels like yesterday, 16 years now. This year, I've recently stepped into the business ownership and I've opened my own clinic called Optimum Wellness. I'm a traditionally trained physiotherapist, so some of you may be used to seeing a physio for your back pain, your ankle pain, your knee pain, but one of my big specialties and actually a passion of mine, believe it or not, is the pelvic floor. I find it's an under talked about subject. And the interesting thing is we'll dive a little bit today into it can be an area that changes as we age. I'm a mom of two. I have two boys. They're 6 and 8. So definitely my appreciation of the pelvic floor changed during pregnancy and postpartum. But now as I'm entering into perimenopause, I think this conversation today is going to be crucial for your listeners.
This is great. Listen, while you're talking, I'm sitting here, I'm doing Kegels, and I'm like, no, I know that's wrong, but we're going to get into
And it may be right for you, but it may not be right for you.
So let's start out. What's the pelvic floor? Let's paint this picture. Let's let women understand what's going on.
Right. So that is such a good question. I think I take for granted. I talk about the pelvic floor every day, but many of us don't know about the pelvic floor. So the pelvic floor I like to describe as a small but mighty area of our body. Slightly different for people born female versus born male. But a group of muscles, connective tissues, and ligaments housed in the base of the pelvis. It's almost like the bowl of support at the very bottom of our spine. The pelvic floor has multiple functions. The interesting thing is most people don't think about their pelvic floor until there's a dysfunction.
Okay.
So the roles and function of the pelvic floor, we talk about the 5 S's in my industry. So that is the pelvic floor is responsible for support. So supporting our insides, it's almost like a hammock function for our pelvic floor organs. Stability, this is one of the core muscles. Oftentimes we think about the abdominal muscles being the core muscles. The pelvic floor is really important for that. Sexual function, this is a biggie. I feel like it's under talked about, whether it be with friends or definitely in the healthcare industry, but the pelvic floor is huge for sexual function. Sphincter control. So that's a fancy way of saying how we hold our urine and our bowels and we prevent leaking, which I think we're going to talk about. And then the final one is what we call a sump pump. That's a way to talk about the pelvic floor has a role in returning the lymphatic system or the drainage of the body, believe it or not. So an area in the base of our pelvis that is so small but so mighty and so powerful.
Okay. Thank you. Thank you for laying it all out for us. So let's start out with common signs and symptoms when we're talking about pelvic floor dysfunction.
So, good question. So some of the top signs that I see as dysfunction or things that bring people into my office, I would say probably the most common is incontinence. Incontinence is the involuntary leakage of urine or feces. Urine is definitely more commonly reported, and I think it is a bit more common, but that's basically, when I need to pee and I can't hold it. Or maybe I cough or I sneeze and some pee comes out.
Okay.
Some people do definitely have this similar with bowel dysfunction, but it's one of the things that is one of the most common dysfunctions of the pelvic floor. Some other dysfunctions that we see is symptoms of pressure and heaviness in the pelvic floor, that may be a sign or a symptom of pelvic organ prolapse, which is one or more of the pelvic organs descending or dropping. Some other common signs of dysfunction: pain, that's a big thing, whether it be pain at rest, pelvic pain. We even can think about the pelvic floor for things like back pain. So interesting, women who report back pain, 80% of them will have some degree of pelvic floor dysfunction.
Okay.
That's huge.
Yeah.
And most times when you're seeing a provider about back pain, understandably, but they don't ask about the pelvic floor. Okay. And also another big thing, pain during sexual intercourse, which I think as we talk about some hormonal changes today, I'll touch on a bit more. But I would say those are the most common signs of dysfunction of the pelvic floor. That is not to say if you have something else that it's not the pelvic floor, but without going into a deep list of all the potential signs, those are the most common I see in my practice.
Okay, so what's the difference between coming to see you for pelvic floor health versus, going to a medical practitioner? Like, can you explain what sort of assessment that you would do that is different from going to a GP or a specialist?
So a GP is someone who has a lot of general information about everything. The difference with me is I have specific training in the pelvic floor. So a common assessment for someone who comes in for a pelvic floor complaint, the biggest thing that I say to people when I'm seeing them is when we talk about the pelvic floor, I feel like I need a hat that says detective because the pelvic floor is so multifunctional. It's probably in everything in the body I treat, I find it's one of the more complex things because what may be an issue for you may not be for anybody else. So my biggest assessment tool is a subjective interview. That means I'm going to ask you questions that you may think of, but some questions you might not. So some of the common things that I ask during a pelvic floor interview or assessment, would be, tell me about your symptoms. Tell me about your history. Have we had any children? If so, what was pregnancy like? What was birth like? Talk a lot about hormones. So what age did menstruation start? Depending on the age, are you still having a menstrual cycle? Have you had a hysterectomy? Because that's different. People who've had hysterectomies don't always know what age they're going to enter into menopause because we stop bleeding after a hysterectomy. What sort of hormonal contraceptions are we on, or any sort of medications like hormonal replacement? Symptoms about what's going on, depending on that, things like what may affect your bladder. What are you eating? What are you drinking? These are things that can have a role in, for instance, incontinence. I only leak in the morning when I go for my run, but I don't leak in the afternoon. Okay, tell me, what do we drink? Caffeine. That could be something that can really aggravate the bladder, that can make your symptoms worse. Bowel health is something that I ask a lot about. So people may say, but why? I'm here to talk about leaking urine, for instance, and what's my poop have to do with this? So the bladder and bowel are like siblings, they go together. So many people may be chronically constipated. Okay. And this is not necessarily something that your medical doctor is gonna ask about, but that may mean that for years you've strained to have a bowel movement and your pelvic floor may be a bit weaker.
Okay.
From there, I'll ask other questions. Sexual health is a big thing, so tell me about intercourse. And I get some people who are open book, they'll tell me everything. Some people, it will take a little bit more to kind of get it out. And I usually say to people, I'm so honored to work in the pelvic floor region. It means people trust me with their most intimate details, and I don't take that lightly, but I will meet everybody where they're at in a very respectful manner. So after and oftentimes on my first session with someone, it's half-hour questions. And I will have usually by then such a good idea of what's going on. Okay. And then from there, I'll make a treatment plan. And that may mean we talk about the pelvic floor, we do some education. I give some specific exercises. For some people, the first treatment is, let's try and target your bowels to help with whatever else is going on.
Okay.
I can do internal assessments of the pelvic floor, meaning if need be, and this is not everybody, but if need be, I can actually assess the pelvic floor to figure out what's going on with the tissues. How strong are the muscles? How weak are the muscles? Can they relax? And that can give us some added benefit, but I would say that's a very sort of small subset of what I do. And depending on if people have done a quick Google search, they may come in thinking, that's what she's gonna do. Definitely not on a first assessment with the person. if need be, if I need a bit more education or some more knowing what's happening with your body, that's something that I can do.
Okay.
So that's a brief overview of what a pelvic floor assessment looks like. And then we'll talk about some treatment.
Yes, that was a lot in there. So what does this look like for the woman that is going through perimenopause or menopause, and especially when it comes to sexual dysfunction?
So perimenopause and menopause is an interesting time. It's a different age for everybody. So it doesn't mean we're 40, this is going to happen. But it's definitely a time in our life where our hormones start to decline. And for some women, that means they're going to start to become symptomatic. And this is not to say that everything I talk about today is going to happen to everybody, because we know it's not linear.
Absolutely.
But oftentimes I find between the hormonal change and decline, plus also like an accumulation of life events, right? So we touched a little bit, we may have had a pregnancy or two, we may have had some childbirth. We may also have some habits that have sort of put us in perhaps a state. It doesn't always mean a weakened state, but I find this coupled with the declining hormones often bring people into my office with symptoms they've never had.
Okay.
We talk about some of the common symptoms, but specifically you asked about what does this mean for my sexual health? What are some of the things that I'm seeing? So as our hormones decline, I would say one of the biggest things that can happen from a sexual health perspective is pain with sexual intercourse.
Okay.
And again, this is something that so many people don't even know. Who do I tell this? You know, my GP may not even ask, or will they even know what to do? So again, here I come back to, it's a lot of the questions I ask because it's different for everybody. But definitely the decrease in especially estrogen means that our tissues may thin out a bit. So we may be having, you know, atrophy of the tissue, which basically means muscle weakness and thinness. And with some friction of penetration of various sorts, that may be painful. We couple that with decreased lubrication. So we may get dry and not realize, and, you know, increase with penetration, that decrease in lubrication just means dry and friction. That's not a very common or comfortable thing to have.
Exactly. Or talk about.
Exactly. And some of us are great. Some of us with our girlfriends will say, hey, what's going on? But I talk to people who are like, oh my goodness, I've had this for years and years. And then we couple that with some people have a decrease in their libido. So we may have pain with something that we generally have associated pleasure with. And that when we start experiencing pain, it doesn't always make our brain think, I want to do that again.
Yes.
So it's another thing. It's like, okay, we can talk about this. There are things that I recommend. So definitely the education part of what I do around the pelvic floor is huge. So depending on symptoms, like if it's dryness, some people don't realize we can use a water-based lubricant. And that's going to decrease friction, which can decrease pain. If I'm under the impression that something's very hormonal, it is out of my scope of practice to make recommendations or prescribe medications. But this is where such a big part, and I think with your podcast of talking to industry experts, it's this idea of I work within a referral source. So, you know, is this something that I may need to refer or suggest you see a gynecologist? Is this something that either your GP or endocrinologist can suggest some hormonal replacement? Especially for pain with intercourse, some women may find they need some topical estrogen to help to kind of plump those tissues back up. And then some of the more traditional physiotherapy things that we can do is like an exercise-based therapy.
We're going to get to this.
Okay,
That's good. We might as well.
We're going there. So some of the exercise. So I think the big kind of elephant in the room when we talk about pelvic floor is Kegels.
Exactly.
And I haven't mentioned them yet.
Exactly. And I'm already doing it. I'm
Yeah,
like,
exactly. He's just here overworking our pelvic floor practice in her Kegels. So I am an evidence-based practitioner, so I like statistics. 3 out of 4 women don't do Kegels correctly. So if we had 2 other people at this table, I may be the only one doing it right, or you.
Oh, wow.
Okay.
Okay.
So all of that to say that a Kegel exercise is an exercise that talks about contracting the pelvic floor. Some of us have been taught about it. Most of us have heard about it, but haven't received that formal training or education on what to do. Oftentimes, if we've had a child, people may talk about your Kegels then, but with people not always knowing how to do the exercise, or even where to do the exercise. So one of the common things people will tell me is, Michelle, I do my Kegels all the time. Every time I sit down to pee, I Kegel. And I think, I try and hide my face and I say, right exercise, wrong location. Because in that setting, your pelvic floor should be relaxing to allow you to urinate or have a bowel movement. So if we're always clenching, that's going to make it a bit harder. Speaking of, there's always clenching. A dysfunctional pelvic floor doesn't mean you have a weak pelvic floor. And a Kegel exercise strengthens, which basically you would do for a weak muscle.
Yes.
Now, the relaxation or the letting it go is, I would say, almost just as important, maybe even a bit more important.
Okay.
So for those of us doing our Kegels all the time, if we're always up here, the muscle actually can't relax. And we need full relaxation of the muscle to allow a proper contraction and relaxation.
Okay.
Now, what does that mean? So that means I get some people who come in with pelvic floor dysfunction that I actually may get some signs and ideas that maybe their pelvic floor is actually a bit too tight. Now, usually when I say that, people light up. It's like, oh, my pelvic floor is too tight. That does not equate to how things feel sexually.
Yes.
Right? It often just means that, people may be leaking when they, for instance, jump, because if their pelvic floor is not relaxing, it can't generate the strength to turn off the urine flow.
Exactly.
It may mean we're having pain with intercourse because for penetration, the muscles need to relax to open up. And if we're always tight, Kegel, which I will add, it's not always just doing too many Kegels that may make us a bit tighter than ideal. There's other factors.
Yes, of course.
And this is where I say, again, I'm kind of coming back to the beginning. All these questions that I ask someone to begin with, by the time I finish my little question part, I have an idea and I can almost predict. And I'll say to people, I have a hypothesis. Now, that's not to say that if your pelvic floor is too tight, that we're never going to Kegel or strengthen. My goal for everybody that I work with is to have an optimal pelvic floor.
So how do we do that?
Okay, so optimal pelvic floor means a pelvic floor that can contract and a pelvic floor that can relax.
Okay.
So let's do it.
Okay.
So the biggest thing with the pelvic floor is a hard area to see, feel, or touch.
Okay.
We can do that in certain settings, but the biggest thing I say to people is ideally I want to give you a tool that you can do this exercise without having to lay down with a mirror or touch or things like that. And the tool that we use is imagery.
Okay.
So I want you to imagine
a
marble. Okay.
Yes.
It's purple.
Got it.
So again, your brain's like, here, I got something concrete. And I want you to imagine that at your vaginal opening.
Got it.
Okay. And from there, I want you to, and again, we talked about where the pelvic floor is. I want you to imagine using the muscles around the vaginal opening to squeeze and lift like you were trying to pull that marble inside of you.
Okay.
Okay. Once it's up, I want you to relax and let it go. So again, let's do that again. So we have a squeeze and a lift, like we're pulling our purple marble inside of us.
Yeah.
And then a relax and let go.
Why am I not breathing?
Oh, so you're concentrating, okay? Now, so you are very nicely, like I'm almost taking you as an assessment, right? Now, some people will do that and I'll see sort of them clench or I'll see their body move. For you, it's a concentration thing. Without kind of going too technical on you, the pelvic floor and the diaphragm, which is our breathing muscle, work together.
Yes.
Okay. And this happens with the pelvic floor subconsciously or unconsciously. It's kind of like our heart, right? Our heart beats without us thinking about what to do. The same with the pelvic floor and the diaphragm. So often I will teach breathing as either a start or a progression for the pelvic floor because we can use that connection of breathing with the pelvic floor. So as your body started to concentrate, your breathing stopped, and that's normal. That doesn't mean you're dysfunctional, but it's normal. So what I normally then say to people is, okay, so we had a squeeze, a lift, and a relax and let go. What was the easiest for you?
The lift.
Okay. What was the hardest?
The let go.
Interesting. So, and that may just be because you've been doing your Kegels all this time.
Exactly.
Maybe you've never thought about the let go. That doesn't mean, like, regardless of what people tell me when I ask them for feedback, it doesn't mean that I can say, oh, that's because of this.
Yes.
But as something that, I may sort of prescribe to women to say, try that, you're going to get sort of more comfortable doing that.
Okay. Okay.
Okay.
Okay.
Now, I will add that is a very small intro to the pelvic floor. That exercise is not for everybody, but it's actually a common place that I will start.
Okay.
From there, I progress people. You know, I may say oftentimes we have to look outside of the pelvic floor. So once we kind of get our pelvic floor a bit more optimal, I feel like I can squeeze and lift, I'm relaxing and letting go. Sometimes we have to look at what's going on, the diaphragm.
Yes.
What's happening with your breathing,
Exactly.
right? What's happening at the hips, the knees. I see this lever in the pelvic floor world that it goes one way versus the other. Right now, all the talk and the hype is around no Kegels. So saying to our patients, we don't really need Kegels. Let's do some weight training. Let's do some lower extremity exercises. Let's do some breathing. I'm generally in my life quite a neutral person, including in my practice. And I do find the role of both. So some pelvic floor specific exercises, but also some general exercises to help wherever you may have some dysfunction.
Okay. This is a lot. And I know there's tons of different therapies that you would also incorporate. Okay. So on a daily basis, what should I be thinking about, or what should women be thinking about?
So if I had to give a blanket advice for people on a daily basis, the first thing I would say is just some deep breathing. Now, what happens with deep breathing, without us even thinking about our pelvic floor, there's going to be a natural movement. So as we breathe in deeply, our pelvic floor relaxes. As we exhale that breath, our pelvic floor contracts a little bit. And I find if I'm going to give a general recommendation, that's going to be helpful for everybody.
Okay.
It will also start to help our nervous system, because deep breathing, meditation, I'm sure some of your other guests are going to talk about this, relaxation. It's almost like my one little gift to people that I say, without being able to say, do you need to strengthen your pelvic floor or do you need to relax it? The breathing, I feel like, is helpful on multiple levels for everybody, which may surprise you, because I think when people think, what's she going to say for the pelvic floor? And then she talk about breathing.
Exactly.
But it's a bit of a safe exercise for everybody. And then if I had to say some other little kind of day-to-day things that may help your pelvic floor without risking being too specific and prescribing Kegels for everybody, it would be the things like make sure you're getting enough fiber from your diet to help with your bowels, doing a little bit of physical activity, whether that's walking, which may help with weight management, which is going to help the pelvic floor, or even a bit of strength training, which is going to help the muscles around the pelvic floor.
Okay. This is, Michelle, we could talk about this for absolute hour. So we've got some exercises. We know that coming to you, there are other therapies and treatments that you can also do as well. But that first step, and I think you touched on it earlier, women may feel embarrassed about even opening up. What advice would you give to them to somebody that is hesitant to seek help, and then follow that with, how can people reach you? How can we even get an appointment with you?
That's a really great question. And it's something that, I wish I could shout this to, on the rooftop to women, because so many people suffer in silence. And you're right, if you're not comfortable talking about this, how are we ever going to help? Or, I get people in my office daily that say, I didn't even know people like you existed. So firstly, the nice thing is you don't need a referral to see me. So if you're listening to the Beauty and Wise and you're thinking, I need her help, you can just reach out to me. No one needs to know. Your doctor doesn't need to know. They can know, and they would be happy to do that. But you can reach out to me directly. So my website has loads of information, including contact details. And now, thank goodness for technology, you can even book online. So that's www.optimumwellness.bm. My email is also on there. I'm on Instagram as well. I don't post a lot on there, but it's definitely a form of communication. But my main thing is to say to people, there's help. And even if you're unsure, I may not be the person, but I find one of my biggest roles these days as a physiotherapist is I'm helping people navigate the medical system. So if I can't help you, maybe I can refer you to a urologist. Maybe I can help you to choose a gynecologist, or even encourage you to, see somebody for your mental health as well. Because again, even when we talk about sexual dysfunction, there's a huge link to kind of how we're feeling. And sometimes we need somebody to help with that.
Absolutely. No, thank you. I appreciate that. Anything else before we wrap up that you want to add? I mean, I'm sure you probably have a ton of things, but anything else you want to end with?
It's funny, whenever I do talks like this, I think, oh my goodness, I didn't talk about this or that. But you're absolutely right. Within, our time together, I hope I've given your viewers and you a good understanding and a brief understanding of what the pelvic floor is, what are some common dysfunctions. Nothing else I want to add except a reminder, if people are having any sort of dysfunction, there are people like myself that are very happy to help. So reach out. And I just thank you for giving me the time to, again, part of me shouting on the rooftops to people our methods and modes like this. So thank you.
Thank you. And we'll definitely have you back because you're absolutely right. There's so many ways we can take this topic, but yes, you'll be back for sure.
Thank you.
So for everyone, thank you for tuning in for Beauty and the Wise, our episode with Michelle Monk. All of Michelle's details will be in the show notes in regards to how you can reach out to her, her website, her email. Please, like she said, you don't need to suffer in silence. That's what we're here for. We want to equip you with the information that you need so that you can advocate for your own health and well-being. Thank you for tuning in to Beauty and the Wise.